Good afternoon. My name is Adrian Dix. I'm BC's Minister of Health. To my right is Dr. Bonnie Henry, BC's Provincial Health Officer, and this is our COVID-19 briefing for British Columbia for Monday, November the 23rd. We're honored to be here on the territories of the Lekwungen-speaking people of the Songhees and the Esquimalt First Nations. The schedule of briefings will be slightly different this week. We'll be briefing in person today, Monday, as well as Wednesday and Friday. On Tuesday and Thursdays, there will be written briefings with case counts and other relevant information about COVID-19 in British Columbia at around 3 o'clock. And with that, I'm honored to introduce Dr. Bonnie Henry.
For today, we are reporting on the 3 periods from Friday to Saturday, Saturday to Sunday, and Sunday to today. From Friday to Saturday, we had 713 new cases of COVID-19. Saturday to Sunday, an additional 626 new cases, and from Sunday to today, 594. For a total of 1,933 new cases of COVID-19 over the past weekend, including 11 of which were epidemiologically linked. That brings our total number of people with COVID-19 in British Columbia to 27,407. The new cases by health authority, 414 people were in the Vancouver Coastal Health Region, 1,304 people were in the Fraser Health Region, 48 people on Vancouver Island, 104 people in the Interior Health Region, and 61 people in the Northern Health Region, and an additional 2 people who normally reside outside of Canada. We now have 7,360 active cases in British Columbia, of whom 277 are in hospital today, 59 of whom are in critical care or ICU. We have 10,200 people under active public health monitoring and 19,069 who have recovered from COVID-19. As we've moved into this phase of our pandemic, our hospitalizations and our transmission in long-term care has increased, and over this past weekend we've had 17 people who've died from COVID-19, bringing our total to 348 people. The majority of these people were seniors and elders in long-term care, and we send our condolences and our thoughts and prayers to the families, to the caregivers. We know how challenging it is right now when we have an outbreak in long-term care, and to the communities of our people who have died. Right now we have 6 new healthcare outbreaks in the North Peace Senior Housing, Queen's Park Care Centre, Care Life Fleetwood, Sunset Manor, Renfrew Care Centre, and Lionsgate Hospital. 2 outbreaks have been declared over at the Nanaimo Regional General Hospital and Evergreen Baptist Care Society. That leaves us with 60 active outbreaks in our health care system, 54 in long-term care and assisted living, and 6 in acute care. We now have 970 active cases in long-term care, including 583 residents and 365 staff. And that is a very sobering thought for us, knowing how challenging our long-term care outbreaks can be. And that really speaks to where we are right now in our pandemic here in British Columbia. It is the most challenging of our time, and we are all feeling the strain. This virus doesn't pause, though, when we're tired and frustrated and we want it to be over. And it doesn't pause when we're out with our friends, our family members, those we care with. It spreads quickly and doesn't wait for us to catch up. I say this not to give up hope, of course, because I do think there is hope, but to remind us that we have the knowledge, the tools, and the resources to control this virus and not let it control us. I say this to fuel that fire of determination and resilience that I have seen in people across this province. That when we see these challenges, we all think about what can we do today to make a difference. And right now, that means doing a bit more to get over this hurdle. Over the next 2 weeks, we need to urgently reduce the level of transmission in our province to keep our schools and workplaces open and relieve that very real stress we are seeing right now on our healthcare system. That means reducing our social gatherings, our social interactions and events. Protecting our hospitals, workplaces, and schools is the important thing we must focus on now. We have been learning. It's not the same as it was even a few weeks ago. We've learned that as we've moved into winter, the virus spreads more easily. And we're seeing that across the globe and across the country. And we need to pay attention to that as we've seen increases in our healthcare system as well. And that is why we put in the new orders that we did last week. These orders that are province-wide orders are very similar to the previous regional order we had put in place in the Fraser Health and Vancouver Coastal, but there are some differences, and they do apply across the province. And to be clear, the new orders supersede what we had in place before. When new orders come into effect, it is not unusual. We get asked a lot of questions, and people want to know, what does this mean to me and the changes to me in my specific situation? And while I want you to understand the new safety measures and restrictions, I'm asking people to focus on the intent of the orders, what we are trying to do together now to address what we are seeing in our pandemic here in BC. So reducing our social interactions as much as possible. That is where we are seeing transmission of the virus, particularly indoors, but it is to those people we are closest with, whether at work, at home, our social family, our social connections. I'm asking you to put the safety measures at the top of your list every day, rather than thinking about where the gaps are, where the shortcuts are, is there a workaround, is there a way I can get around this order? Simply put, we all need to focus on making a difference today. In our homes, we should only be with our immediate household, those people we live with. That means no visits, social visits from extended family or friends. Yes, it does mean you can help your mother if there's a concern. It does mean that you can carpool to take your children to school. It does mean that grandparents can care for children. But what we mean is no hosting of gatherings, no dinner parties, no backyard barbecues, no play dates right now. This next 2 weeks is critical for us across the province. But I do know connection is important. And that's why we've said if you live alone, you can, of course, have those 1 or 2 people that are in your close bubble that you have close connection with, whether that's a partner, a relative, a friend. And of course, we know that there's connections with co-parenting and other important connections. You can also go for a walk, go for a bike ride with a friend or 2 friends. Go outside with your family. We've said this from the very beginning, and it's important that we continue to look after our mental health and our physical health. Get outside, go for a walk, keep your distance. Take advantage of when we can get outside and the places that are in your community to let off some of that concern, to get some physical exercise, to have that time with people. I have also suspended all events as defined in my gatherings and events order. And that apparently I needed some details in it. So with the exception being funerals, weddings, and ceremonies such as baptisms, which have increased restrictions on them. But it does include events at hotels, restaurants, bars, and does include movie theaters and cinemas. I know this has meant delaying the opening of some very great and well thought out seasonal events like the holiday train in Stanley Park and the Bouchard Garden light display, among many others that had previously been approved across the province. Those are suspended. We need to monitor what we are doing right now and reduce the potential for social interactions. That has meant pausing all in-person gatherings and shifting to virtual services, whether they're religious services, performances, fundraisers. The vast majority of event organizers and venues have been doing a great job and have robust COVID-19 safety plans, and we know they've been working. But we need to take a pause, whether you call it a circuit break. Now, for these next 2 weeks in this province, all of us need to stop these events and pause so that we can get control of this virus. That does not include in meetings such as city council meetings or support group meetings and business meetings, but I would say as much as possible, we need people to take those virtual, to have the ability to do it virtually if you can. And if you must meet in person, and I know there are some reasons why some of these groups, it's important for people to be in person, you must have COVID safety plans in place. It must be the smallest number possible, and you must keep all of those layers of protection in place. So ask yourself, is it a gathering? Is it an event? Is it something that I can do virtually? Can we postpone it? And if it is one of these events, it is not to happen right now. This is in place until December 7th, and we will monitor. We will continue to monitor daily, and we'll be looking at what are the things, where are the issues, what are we seeing where transmission is still occurring, and we will update you as we go towards December 7th. Some people have spoken about this pandemic as a marathon with a far distant finish line. But I've come to think of it really as an Ironman race. I've run marathons, but I've never run an Ironman, where it's not one leg, but 3 different, strenuous, difficult legs. A swim, and then a bike, and then a marathon. We got through the swim, barely, this spring, and we learned. We learned quite a bit. And now we are on the bike ride. And this bike ride has some big hills to climb. And we don't know exactly when this part of the race is going to end and when we're going to move into the next phase. But we all know that while you may have to slow down when you're going uphill, we can get over the top and we can enjoy the downhill on the other side. But right now we have a distance to go, and we don't know yet where the finish line is. The next leg is not quite in sight, which means we need to gather our focus and our energy together now. When vaccines are approved and available, we'll be able to transition to our next phase, to that run that will have a finish line, to get into our rhythm and to steadily move forward. I understand that this pandemic is tiring, and the orders make it more difficult. We don't want to have these things in place. But right now, we need to focus on today. Focus on the intent of what we're trying to do right now, which is stop those transmissions from happening, reducing our connections so that we can get through this phase of the pandemic together. Instead of thinking, how can I find my way around this? Think about your way to stop the spread. What can I do today to make a difference? And remember that we all need to show compassion and understanding and do our part to get through this leg of the race. But we will get through this, and we will do it by focusing on what we can do individually and together, and by being kind and being calm and being safe.
Thank you very much, Dr. Henry. And I wanted to start by saying 17 people died this weekend from COVID-19 in British Columbia, and that's was 4 from Friday to Saturday, and 8 from Saturday to Sunday, and 5 from Sunday to today. 13 of them lived in Fraser Health, and 4 lived in the Vancouver Coastal Health region. And I think I speak for everyone in the province when I say that we send our condolences to families who are struggling with this right now. It is a very, very difficult time to lose a loved one under any circumstances, but particularly due to COVID-19. And every person matters, every case matters, and when we lose 17 people, that is a profound loss for us, one that affects us greatly here. And we want to say to everybody that we are thinking of them and we are with them in this difficult time. I know that people in healthcare are working extraordinarily hard. Dr. Henry talked about the 7,360 cases, the 10,200 people who are self-isolated and under public health surveillance. It is extraordinary, in fact, the work that's being done by people in public health. It's a massive and coordinated effort, and I want to express my appreciation to all of those people. I spent a good deal of time on the weekend, I know Dr. Henry did as well, answering phone calls and talking to people about the orders that were brought in on Thursday. And I think, and I want everyone to know, that I think it's a good thing. I think that the fact that people have questions, that they want to comply, that they want to engage, is a good thing. And I just want to say broadly about these questions the following. That often when we are trying to make changes in public life, we negotiate, we litigate, we compare ourselves with other groups, but that's not what these public health orders and guidance seek to do. They are tools for all of us to help stop this transmission of COVID-19, because we can't negotiate with the virus, which has one goal, which is to transmit. It has one goal, and we can't deal with it that way. There's no litigation to be had, and I think sometimes we lose sight of this in our discussions of these questions. I wanted to just specifically on the issue of events reinforce what the order says, and it will take a moment, but I think it's important to look at what the order says, and this has been as a definition of event under the orders, and it refers to anything which gathers people together on a one-time, regular or irregular basis, including a gathering in vacation accommodation, a private residence, banquet hall, or other place, a party, worship service, ceremony, or celebration of any type, reception, wedding, funeral, celebration of life, musical, theatrical, or dance entertainment or performance, live band performance, disc jockey performance, strip dancing, comedic act, art show, magic show, puppet show, fashion show, book signing, reading, recitation, display, movie, film, meeting, conference, lecture, talk, educational presentation, except in a school or post-secondary educational institution, auction, fundraising, benefit, contest, competition, quiz, game, rally, festival, presentation, demonstration, athletic, sporting, or other physical activity, exhibition, market, or fair, including a trade fair, agricultural fair, seasonal fair, or episodic indoor event that has as its primary purchase the sale of merchandise or services, e.g. Christmas craft markets, home shows, antique fairs, and the like, and for certainty, including a gathering preceding or following another event. And that is available and the most recent version of it, because it's been amended, is available under PHO Order November 10th, page 3. And I think what it says is that what we're trying to do here, and these are all both religious and secular events, of course, of all kinds, except with weddings and funerals and baptism, where we have a maximum of 10 people, which is itself difficult, but that is an exception from the rule. Is what we're asking people to do is to reduce social interaction in this period, that this is one of our means in our calm, considered, compassionate, thoughtful, science-based, and massively resource response to COVID-19 in BC. These are the means by which we together can fight the virus. And I encourage everyone with the orders that were put in last Thursday to see them as tools by which we can do that and maintain the values. And if we're going to think about injustice, think about the injustice of the people that we lost this weekend. Think about the people in long-term care living with outbreaks right now, and all the people working with them and the families involved, because that is injustice, but it's not an injustice that we can fight by getting angry. It's an injustice we can only fight by following the advice and the guidance of Dr. Henry and her team. I have a couple of updates I wanted to bring up today on that we regularly provide, one with respect to PPE. As you know, since March, the following has arrived in BC, or as we announced as of last Monday, November 16th, 7.5 million N95 or equivalent respirators, almost 126,400,000 surgical or procedure masks, almost 2.9 million pieces of eye protection, including goggles and face shields, just over 223,600,000 pairs of gloves, and just over 14 million gowns. Over the past week, the following PPE has arrived in BC: 268,616 N95 or equivalent respirators, 4,292,350 surgical procedure masks, 5,100 pieces of eye protection, 11,780,550 pairs of gloves, and 1,023,275 gowns. As I mentioned last week, and this has not been included in these totals yet, as we're working to inspect and sort a huge arrival that came on November 12th, but that arrival includes approximately 43.2 million pairs of gloves, 105,000 gowns, 24 million procedure masks, and 21,600 procedure masks with a visor. And I want to thank everyone involved in doing that extraordinary work and also doing the work to ensure that all of this material meets the test of our public healthcare system and the requirements of the people who work in it. I want to also bring you up to date on our influenza vaccine measures, and this is a good news story in the sense that based on both national and provincial surveillance, that all indicators of influenza activity remain exceptionally low, as Dr. Henry reported last week for this time of the year, despite the increased level of testing. To date, there is no evidence of influenza circulating in BC communities, and no long-term care facility influenza outbreaks have been reported so far in 2021. Just to put it in context, about 2,027,300 doses of flu vaccines have been distributed by the BC CDC to regional health authorities. And just to put it in comparative sense, as of November 23rd, we know that at least 1,069,542 doses of influenza vaccine have been administered in BC. We know that the actual number is higher, but there's a reporting lag of up to 30 days from pharmacists and physicians and other community providers, such as nurse practitioners. But this is, in this context, an extraordinary achievement. And just to give you some measure of comparison in that regard, last year at this time, or as of November 23rd, in the 2019-20 year, 518,025 doses had been administered by pharmacists. This year, that number is 808,001. In terms of doctors' offices, those numbers are up about 100,000 over last year, and of course, a significant number have been distributed by public health. So this is, I think, an extraordinary achievement. So just in conclusion, and I would say, as Dr. Henry has said many times, I think we at our home we use this quote more than anything else, that this time is for now and not forever, and that's true. But now, of course, it's time to take a pause, and it involves, I think, the orders that we've made and the actions we're asking all of you to take that will support public health in its efforts to help people deal with COVID-19. I don't think Dr. Henry would be making new orders if we were immune to COVID-19. I know she wouldn't be. We wouldn't be asked to take action right now if it didn't have an immediate impact on our health, our safety, and our future. And you can see this week how clearly that is. We certainly wouldn't have asked to make this sacrifice if it didn't save lives. You can't barter with COVID-19. It doesn't, there's no litigation launched by COVID-19 as to whether it infects us at one age or another. There's no arguing with COVID-19 as to whether it deserves to enter our household or someone else's. There's only a virus that seeks to thrive based on our humanity, our need to connect, our desire to gather, our nature to share. Our are all good things. All of the events I've listed, or at least just about all in the event order, are things that make our society, our life more worth living. They're the things we do together. We are social beings, and all of them, when we do more of them, tend to be an example of broader public health. It is a difficult time, but we must use the skills we've been taught. We must follow the guidance we've been given. We must fill the promise of the orders we have put in place to help keep us safe. Aujourd'hui, nous faisons le point sur le nombre de nouveaux cas pour 3 périodes de référence de 24 heures chacune. Il y a eu 17 nouveaux décès liés au COVID-19 durant ces 3 périodes de référence et nous offrons nos condoléances aux familles et aux amis des 348 personnes décédées du COVID-19 et à tous ceux qui ont perdu des êtres chers au cours de cette pandémie. À ce jour, 19 069 personnes dont le test de dépistage de COVID-19 était positif sont maintenant rétablies. Pour la première période de référence, c'est de vendredi à samedi, nous avons eu 713 nouveaux cas. Pour la deuxième période de référence, de samedi au dimanche, nous avons eu 626 nouveaux cas. Au cours des dernières 24 heures, 594 nouveaux cas se sont ajoutés. Et il y a maintenant, parmi l'ensemble, je veux dire, des cas confirmés de COVID-19, 277 personnes sont actuellement hospitalisées, dont 58 en soins intensifs. Merci beaucoup. Thank you very much. We're happy to take your questions.
Thank you, Minister. As a reminder to everybody on the phone, please press star 1 to enter the queue. You are limited to 1 question and 1 follow-up. I would also ask that you please take your phones off mute. You will not be audible until your name is called. First question today is from Vaughn Palmer, Vancouver Sun.
Good afternoon, Minister. Good afternoon, Dr. Henry. The Seniors Advocate, BC Care Providers Association are both saying that rapid and regular testing of staff in long-term care would be a helpful tool to help contain and identify the growing number of outbreaks in long-term care. It's being done for hockey. It's being done in the film industry. Why isn't it being done in long-term care here in BC?
Yeah, so I saw that. There was reference to some of the rapid tests that have been we've received in small amounts here in the province and in the country. So the short answer is that the testing is not available in what they were describing. But the other part that we need to look at is where this has been done in other provinces. It is not a panacea. It is not what is going to solve our issue because the tests have faults and limitations. And you'd have to test everybody every day. And yes, they certainly do it in some sectors for short periods of time. But the yield and the volume of testing that would require is not at the point where it would be helpful for us instead of the regular screening that we are doing every day. And when we do have outbreaks, as you know, we do test asymptomatic workers as well as the residents in care homes and in long-term care and in the hospitals as needed. So, we have protocols that do work. These are challenging times. We don't yet have that type of a test that we could easily every day have somebody test, and I will note that we've seen limitations of those even in places where they do it on a regular basis, including the NHL didn't have a problem, but certainly on some movie sets we've seen it in the United States in some situations too. So it's absolutely important, and we will be looking at it as we have the tools. We'll be using them as we can, but we are optimizing what we do have right now to try and prevent. And the other thing I think that's really, really important is the risk in our care homes is proportional to the risk in our communities, and we see that. And we have to be very mindful that we as healthcare workers need to watch what we are doing in the community so that we don't take on risk from some of the social interactions that we then take into work. And that's something right now we absolutely need to focus on.
Do you have a follow-up, Bon?
Yes, the stats today, 58 people dead in the last 10 days, and from what I've seen from BC Centre for Disease Control, about two-thirds of the deaths in BC from COVID-19 are long-term care residents. I keep hearing from long-term care residents who they say it's not us, it's not the visitors, it's got to be the staff. Doesn't the rate of the spread here and the death rate lend a sense of urgency to doing more than's being done?
You know what? I can't say that there is more that is more urgent to us than doing everything we can in our long-term care homes. And I'm not sure that I know of anything more that we can do. And it is absolutely staff and people who work in care homes that are the index case in many cases. But partly that is a bit of an anomaly because we have reduced so many visitors into long-term care. And when we look at that balance of the density of how many people go in and out of a care home, that's where risk comes in, and that's where risk in the community is reflected in care homes. We have put in orders across the province to address just that so that we can reduce the risk in our communities, and that in turn reduces the risk in our healthcare system.
I think just to say that the investment and the effort has been massive here, and in a comparative sense, one of the reasons, the principal reason, and it's embedded in what you said, Vaughn, that we have lowest rates of mortality of equivalent jurisdictions. The jurisdictions 5 million or more in North America. I think there are 27 of them, and BC has by far the lowest rate of mortality in that group of jurisdictions, states, and provinces, is because of the efforts being made in long-term care, which have been massive in terms of PPE, the single site order, and all the other measures that have been put in place. But also what we need now, I mean, what's very clear, and tell you, nothing is being spared in this regard. And I think, we feel it every day, because I don't think families in long-term care in BC really think very much about what's going on in Winnipeg or what's going on in Nova Scotia. I know our family doesn't, I know other families don't. So I appreciate that every single case, every single outbreak is of concern and of consequence and requires a massive response. And we would love it if there was a single or an easy response to that. There's not. I think the combination of measures that we put in place have been more effective than other places, but that doesn't mean the losses haven't been tremendous and that we don't feel them. Everyone working in the system feels them, and all the families feel them, and especially those who've lost loved ones feel them. So the effort will continue. There's not a day goes by when we don't talk about what more we could do to address the situation in long-term care, and we're going to continue to do that in every moment and every step. As Dr. Henry has said, he's talked about the use of rapid testing and so on, and has been told to me and others, and people will note this, that places such as the White House used a lot of rapid testing as well, but it is not sufficient in itself and can cause its own problems because of the issues with the tests themselves that Dr. Henry has enumerated. So we're going to keep doing everything we can and take every piece of advice we can. I know the care providers provided a report this weekend that I've read through carefully. I obviously read in detail the Seniors Advocates report. Certainly in the areas in which they have specialty, we rely on them, and the areas where Dr. Henry and Public Health has specialty, we rely on Public Health.
Next question is from Richard Zisman, Global News.
Dr. Henry, there are a number of holiday events, as you mentioned, that are being canceled. There are others that are wondering if they qualify in terms of the fact that they are done within a vehicle where someone can drive through a light show. Are those events okay during this time period where the restrictions are in place? And what is it about the outdoor events like the Stanley Park Train or the Butchart Gardens that have you concerned around spread?
Yeah, so right now, for this 2-week period, the events order does not discriminate between indoor and outdoor events. So everything is on pause. It doesn't necessarily mean that things need to be cancelled, and we are looking at, if we are able to get into a place of control, then some of these lower risk events may happen again. But right now, we need to stop all of those opportunities for us to congregate, to go out and do things socially. So right now, all of the events are on pause.
Do you have a follow-up, Richard?
I do. One of the things that was raised over the weekend from spiritual leaders, faith leaders, was, why are their gatherings canceled while bars and restaurants remain open? So what is your answer to that? And then we're also hearing, and I know you've clarified on movie theaters, but movie theaters operated in BC in many places this weekend, and theater companies were confused. So why do you think that confusion happened when movie theaters were able to operate while theaters shut down?
Yeah, so I can't say where that came. It was quite clear in my mind where the events issue was. So we clarified it today that movie theaters do fit into that. And it's the intent of the order that we reduce those opportunities for social interaction. And events at bars and restaurants, I know they were having like live music events, other things, those are also suspended for now. The other thing we do know about restaurants is they feed people, and there's many important ways that they are part of making sure that people can get a meal. So that is one of the reasons why restaurants are not events. They also have very detailed COVID safety plans, and we know when those plans are followed that the risk is low, and that includes no more than 6 people to a table, no table hopping, wearing of masks, and we've supported that with the order that will be coming around where people need to wear masks in indoor public spaces. So it is an important part of many communities being able to, and many people being able to get a meal.
And obviously this weekend and today, Richard, I had lots of discussions myself with faith leaders as Dr. Henry and I and the Premier spoke in advance of making these orders on last Wednesday, about 24 hours in advance of the orders being made, to let them know they were coming, because it was important to do that, and had the opportunity, for example, to speak with His Excellency Archbishop Miller today, who someone I hold in very high regard, and an opportunity to talk about these issues and why it's important. And there is a tendency to say, look over there, to see these as like a speed limit, and it says 80 and maybe I can go 86. That's not what these are. These are efforts. These are provincial health orders to help stop the spread of a virus that is harming our loved ones in long-term care and causing great disruption in our society. And these are the things we're doing together to stop that. And right now, in these 2 weeks until December 7th, events aren't possible. And I know people sometimes want to look and compare and this and that. I would just say this is a time, of course, when we need spiritual support as much as anything else, and this is true regardless of religion. This Sunday is the first Sunday in Advent, and ordinarily I know where I'd be that day, and it's a significant loss, particularly right now, particularly in our congregation and in lots of congregations around the province. So I know that there is loss, but the effort to get the message out virtually and to have virtual services is really important, because it helps us stop the spread of COVID-19. It's not because people haven't done the right thing in the past. They have. There's been extraordinary efforts by faith leaders, by businesses, by everyone to follow guidelines with respect to events, the maximum of 50 people at events. But right now, we just can't have them in this period. We need to stop the spread. That's the advice of public health. These aren't punishments. They're tools all of us can use to help one another deal with COVID-19.
Binder Sajjan, CTV. Binder, are you there?
Christmas events with lights. Yes. Hello.
Go ahead.
Hello, can you hear me? Yeah. Just following up on what Richard was asking there with regards to the events. How much notice would you be able to give these events, if case numbers do go down and they are able to open up? Obviously, December 8th is just a couple of weeks before Christmas, so wondering how quickly that could happen.
I don't have an answer to that. Clearly, we are watching things hour by hour and day by day, but we will have a good sense of whether we're making progress or not and whether we need to adjust. There may be certain things that we're seeing are becoming challenging areas where transmission is happening. There may be need to extend orders. But I am confident that if we do the right thing, we will make a difference. We're not trying to get rid of this virus. We've come to the realization that it's not possible to get it back into nature, to have 0 cases in our setting because of the movement of people, because of where we're situated geographically, and because of the climate and the conditions that we're in right now. So things that we were able to do in the summer, and we had a buffer, I guess, in many ways, because we had got our rates down low enough. We had the weather on our side. We can't get away with those anymore. So we need to take a step back from all of those places where we come together, no matter where it is. And we will see if that is going to make the difference over the next coming weeks. We will never be able to get rid of all of these restrictions until we get to the point where we're into that marathon and we have vaccine available. But we can look to a future in weeks and months where we can have more interaction if we're able to break that cycle right now. I think of what Pericles said to the Athenians in, I think it was 230 BC when they were dealing with the plague. We need to put aside our private sorrows and concentrate on securing our common safety. And that is where we are right now.
Do you have a follow-up, Pinder?
I do. I just want to ask for a little bit of clarity around who you can go to a restaurant, bar, or pub with. You've said when these establishments follow the guidelines, there is a low risk of transmission. So are people able to socialize with those outside their household bubble?
For this 2 weeks, we're saying stick with your household bubble. And for some people, that may mean 1 or 2 people who they have close contact with their pandemic bubble.
Next question is from Brent Richter, North Shore News.
Hi there, Dr. Henry. I'm wondering if there's any more detail that we can learn about how the virus is continuing to get into the care homes and hospitals given all of the restrictions in place.
Yeah, it is through people. This virus is spread through people. We can't always pinpoint, but very often it's when somebody doesn't recognize that they're ill or in that period of time prior to showing symptoms. So that is the bottom line. We've put in measures that have made a huge difference, but as we get more transmission in our community, the probability that anybody who works in healthcare, and there's a lot of us, has the virus and may be infectious to others goes up. So it becomes more and more important that we use all of those layers of protection. If we could understand how we could detect people early, and this is our challenge with some of the tests. We had a lot of really high hopes for some of these rapid tests, but what they're showing is that period of time just before, where people are sometimes most infectious, just before they start to show symptoms, is also the period of time where the tests work least well. So we're in a bit of a conundrum right now about that. The other thing, of course, is that the tests that we have are all right now based on a nasopharyngeal swab, the rapid tests we do. So we're hoping that we can get some easier tests. People don't like having a nasopharyngeal swab every day, and that can be very challenging for people, and then they avoid it. So making sure that we're paying meticulous attention to our own risk, how we're feeling every day, but also the risk around us. So if anybody in our family has been exposed or has illness, we need to make sure that we're paying attention to that as well. And that can be a challenge in healthcare because we tend to be presenteeism. We go to work no matter what because people are depending on us. So we have that balance. Sometimes it's residents, sometimes it's staff. Most often right now staff because residents aren't moving around as much. But it's a challenging situation for us, for sure.
Brent, do you have a follow-up?
Do we have documented cases of people showing up who are symptomatic and we only find out about it after it's too late?
Yes, absolutely. I mean, that is unfortunately the situation, that people don't recognize that they have symptoms, or they're at work in the 24 hours before their symptoms start. And this is why we have now moved as well to universal mask wearing in our healthcare settings. These are things that can help. Right now, as we're seeing increased transmission in communities, that's where mask wearing becomes more important. It may not have had as much of an incremental impact in the summer when our cases were low, but it does make a huge difference now. And that's the reason why we pivoted on the mask wearing as well in the community.
Next question is from Marcia Liederman, Globe and Mail.
Hi there. Thank you so much for taking my question. In the list of prohibited gatherings, Minister Dix mentioned art exhibitions. Does that mean that art galleries need to close, or is this specifically for openings? Can you please clarify that?
Would be events at galleries, yes. Or like individual exhibitions that are set up as an event. So there's some more definitions about what that means, but yes, that's what it would be.
Marcia, do you have a follow-up?
Yeah, I don't really understand what that means. I mean, art galleries have exhibitions on as their primary content. That's what people go to art galleries to see. So is an art exhibition considered a gathering?
Okay, so when you have, they have the opening when they put the paintings up, the opening is an event. The day-to-day with small numbers of people going through is like a retail shop. So there needs to be COVID safety plans in place for that, for the day-to-day operation. Does that make sense?
Next question is from Marcella Bernardo, News 1130.
Hi, Dr. Henry and Minister Dix. Thanks again for taking our questions. My question today is regarding, again, if you could explain the evidence-based rationale behind not making masks mandatory in schools, because we're hearing now from the BCTS that they're not going to listen anymore, and they're going to ask people to wear masks as often as possible in schools in any situation. So is this a situation where certain communities where case numbers are out of control could benefit from making masks mandatory in their schools?
Yeah, so schools are not public spaces where we're with a variety of different people that we don't know on a repeated basis. What schools have are individual COVID safety plans that meet certain criteria. So you're with the same people every day. You don't have people walking in and out. So masks are an important part of some areas of schools, in particular when you're in common areas, when you're with mixing, passing by people in other cohorts, etc. And absolutely, I think that they should encourage mask use, particularly for the adults in the school setting, and that is something that we've been working with them on for quite some time. And we know that teachers have been involved in all of the COVID safety plans in a school. So it's similar to other workplaces where you have plans in place for how you manage within your workspace, not the public areas of a building, for example. So there are COVID safety plans that do include mask wearing in the schools.
Do you have a follow-up, Marcella?
I do. It's regarding if Minister Dix could explain again the influenza situation, where how do we know it's not as prevalent? Or maybe Dr. Henry could explain this as well. How do we know that the flu isn't as prevalent this year as it has been in past years, and what do we owe that to?
Yeah, so we have a very detailed influenza surveillance network in the province that we've had for many years, run at the BC Centre for Disease Control. And there's influenza surveillance bulletins that are on the BC CDC website. And we have a number of different things that we monitor over time. It's one of the networks that we used early on to try and piggyback and do testing for COVID way back in January and February. Because we know that people with respiratory symptoms get tested for influenza. We've had to modify it because people aren't going as frequently to physicians' offices because there's a lot of virtual care. So one aspect of our influenza surveillance is what we call sentinel physician surveillance, and we're now using the COVID testing sites. So a certain proportion of the tests that are done at the COVID testing sites are also tested for influenza as a way of doing surveillance across the province. We also have anybody who's in a physician's office with an influenza-like illnesses who gets tested. We follow those swabs, and we look at the emergency department data around people coming in with influenza-like illness. So there's a whole different categories of types of surveillance that we pull together, and once a week there's a surveillance report. And all of the influenza viruses across the province and across the country are typed, and we report some of that to the Public Health Agency of Canada, and in turn to the World Health Organization. There is a global influenza surveillance network that our BC CDC Public Health Lab is part of as well. So there are many different things we look at, and generally this time of year we start to see influenza increasing. We'd see maybe about 700 to 800 positive influenza tests at our lab by now, and I think up until last week, we saw somewhere around 7. So we are quite confident that we are looking for it, and we're not seeing a lot of influenza circulating right now. We think and we hope that this will continue, and is partly because of the measures that we have in place to prevent transmission of COVID-19, because it is transmitted in very similar ways through droplets that we inhale from somebody who's been sick. So the fact that everybody's going out and getting immunized is very helpful as well. And we saw this in the Southern Hemisphere, so we're hopeful that that will continue. It is also something that gets into our long-term care homes every year. And so we are monitoring anybody who has symptoms in long-term care, gets tested for influenza as well as for COVID. So there's a pretty detailed influenza surveillance network, and we've been using that as well to help us understand how COVID has been transmitted over the past number of months as well.
We have time for one more question. For everyone listening today, Dr. Henry and Minister Dix will release a statement with the latest information on cases, hospitalizations, and outbreaks, which you can find at news.gov.bc.ca. For updated information about the province's restrictions, visit gov.bc.ca/regional restrictions. And for information about the province's new orders and pandemic supports, visit gov.bc.ca/COVID-19. Last question today is from Zara Premji, CBC.
Hi, Dr. Henry. Can you please provide some clarity about the rules around traveling for sports? So some teams are made up of players who live in different but nearby health regions, like a team made up of players from Vancouver and Burnaby, for example. So can those players continue to practice and play together while still respecting the intent of your public health order banning travel related to sports?
Yes, and these clarifications will come, but yes, the intent is that teams won't be traveling to play teams in other regions, and that we won't have tournaments or for other sports. Tournaments are coming together for sports related competitions that make people travel between regions. But yes, if I live in Burnaby and go to school in Vancouver and my soccer team's in Vancouver, then that's fine. What we're talking about is the movement of teams to play in different areas. And I will say that, we put in some very basic guidance. Initially, we had in the region of the Fraser Health and Vancouver Coastal, we had restricted indoor team play until we had a better sense of what were the issues and where were things breaking down in terms of people getting together and transmitting the virus. And so last week we modified it so that we could stay at a version of the Via Sport Phase 3 opening, and with the restrictions for all of the sports, no spectators and no team travel for games. What we are doing, though, is having ongoing conversations with Via Sport, because it's really become clear that we need someplace in between. These staged reopenings were developed as we were heading into the summer and updated in August when we started to move to what we called Phase 3. And it's really recognizing that there's probably a gradation in there. We need somewhere in between the 2 and 3 that allows for some team play between teams in the local area, but also recognizes that for some teams and some venues that it's not possible to have team play without the particularly young people getting together on the bench, or the way that things are structured. It makes it much more challenging and more likely that people are going to come together and maybe have opportunities to spread the virus. So we are working with Via Sport to come out with some guidance that is relevant to where we are right now in the pandemic, and recognizing that for many teams that might mean, and I know some of the local hockey leagues are looking at doing drills and instead of having games right now, and I think that's perfectly appropriate, especially for this period of time, and then we can look at how we go. The intent that we had was to make sure that we still had opportunities for people to participate in sports. We saw that in physical activity, and we saw that early on in the pandemic when everything was stopped, that it really had a detrimental effect, particularly on young people. So we want to get those opportunities to continue, so the ways that they can be done the most safely for your team in your community is what we're asking people to do right now.
Do you have a follow-up, Sarah?
I do, thank you. So, Dr. Henry, I know you've also said that BC is not signing on to this COVID alert app right now because you don't think it will make a big impact, but what do you say to those who want it regardless and are basically frustrated that BC is preventing them from accessing a service by the federal government? And if we can get an answer about the COVID alert app in French as well, please.
Yeah, we're not preventing people from downloading it. You certainly can. What we're not doing is, as public health, having codes, because right now it's leading to more. We have concerns about the potential for increasing work without benefit. We are continuing to talk with the federal government about their app and the changes that we would like to see. We're also talking with Alberta and the Yukon about modifying the Alberta app to make it more aligned with what we would like to see. So it is another tool. Unfortunately, the advice that we got from people on the ground here in BC is that they didn't feel it was a tool that would be helpful for us right now.
Juste pour dire en français que nos spécialistes qui travaillent et qui sont en train de protéger des gens en Colombie-Britannique et de travailler avec des gens en Colombie-Britannique ont conclu que l'app tel qu'il est actuellement n'est pas utile pour nous, pas encore utile. Donc on travaille encore avec le gouvernement du Canada, le gouvernement aussi le gouvernement d'Alberta, le gouvernement de nos amis au Yukon, pour essayer de trouver les moyens pour améliorer cette situation. Et donc on travaille avec nos amis fédéraux et on va laisser les décisions et les recommandations sur cette question aux spécialistes dans le domaine ici en Colombie-Britannique. C'est pas une question politique. Je sais qu'il y a des gens, bien entendu, qui font campagne sur une question d'une app. Il faut avoir une app. Mais je pense que dans une période de pandémie, Ce qu'il faut, c'est une utilité et une démonstration de cette utilité avant de lancer dans ce projet-là. Donc, on travaille avec le gouvernement fédéral, avec d'autres provinces. On va continuer à le faire et j'espère un jour, on va avoir quelque chose qui va marcher tel que pour le système santé en Colombie-Britannique et pour des gens de la Colombie-Britannique. Merci beaucoup. Thank you very much. We'll see you on Wednesday.
Thank you for joining us.